What's a patella fracture? How do you break your kneecap, and what treatments can help you recover from this difficult knee injury? I discuss those questions in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. I can't imagine many knee injuries being more traumatic and being more painful than a patellar fracture. This is basically a break or a fracture of the kneecap. And it's almost always with some kind of direct blow. You fall and land directly on your kneecap, or you're in a car and you're in a car accident and your kneecap hits the dashboard. There are ways to suffer patellar fractures where it's a quick pull across basically the quad and patellar tendons, and it sort of pulls the patella apart. That happens and you just get a transverse patellar fracture, but that's probably not along the more common. Very often these are fractures with direct blows and sometimes can be broken up into a number of different pieces. Now, most patellar fractures, there are some exceptions if it's just a small little piece of bone, but the main, what's called the extensor mechanism, basically the quad tendon, the patella and the patella tendon are all still intact and all still able to function. They can extend the knee and lift your leg off a bed or couch, what's called a straight leg raise. If that's still intact, potentially you don't need surgery, but that's pretty rare. But what's called a comminuted fracture, where it's broken up into a bunch of pieces, or if it's just one fracture line all the way across, but it's such that it's displaced and they're pulled apart, that's going to be something that almost always needs surgery to fix it, whether that's sutures, whether that's screws, wires. There's a variety of different ways to treat it depending on the nature of the injury, but very, very often needs surgery. Now, that surgery can do well, especially if you can get all the pieces put back together just right, but it's a lot of work getting knee motion back and a lot of time and a lot of work with physical therapists. And then once you get the motion back, it's strengthening and then getting your sport specific and exercise specific activities back. It can be a long recovery process. It can be a year before it really feels as good as it did before. Can you speed that recovery maybe with something like peptides, BPC 157, or a variety of growth hormone releasing peptides like CJC 1295? Potentially. I'm not aware of any studies, animal or human, that have looked at that. From a basic science standpoint, maybe the BPC helps with healing. Maybe the CJC 1295 helps with getting the strength back in the recovery phase of this. Again, I've talked about peptides and a variety of other treatments in a number of videos. You can find those on my video channel where I talk about how they're considered experimental or have to be used off label depending on what the treatment is. So I'm not promoting those by any means. I just have a number of people that ask about those. So that is something to know. But again, it's a lot of work. You gotta almost always put that patella back in place, hold it in place with, again, sutures, screws, wired, suture anchors. There's a number of different things potentially that could do it, but usually needs fracture. Needs surgery, and it's a long healing process. Also, because a lot of times the fracture, it displaces enough, it goes into the joint surface. It's not uncommon to develop basically arthritis changes under the kneecap down the road. And that's where maybe you get into discussions of, would something like penisin polysulfate in the days after surgery to limit the damage to the cartilage and bone that progresses into arthritis years down the road, would that potentially be helpful? Maybe. If you develop arthritis under your kneecap months or more likely years after the patellar fracture, maybe regenerative treatments play a role at that point. Things like platelet-rich plasma or stem cells or exosomes may play a role. Again, experimental, off-label, not promoting it. Again, I just have a lot of people ask about it. But devastating injury can have good outcomes, but just know it's a lot of time and a lot of work. Now, I'd love to hear your experience with your knee injury. Leave those in the comments below. Just understand I can't offer you medical advice, but I do try to answer your question in future videos. Make sure to subscribe to my video channel, click the bell to be notified when I release a new video, and start a new live stream like my Ask Dr. Geier live shows. If you have knee, hip, shoulder, or some other bone or joint pain and you want to get significantly better in the next 30 days without cortisone shots, without surgery, you can learn more about working with me in the description below this video. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.